Brandi O'Connor has been involved with Fit Kids since its development in 2006. As Administrative Director of the Comanche County Health Department, she understands that many public health issues are a result of behaviors. She believes being able to change behaviors is key to changing the quality of health for the public, especially the children. Fit Kids of America can help mold children to strive for a healthier lifestyle by using the community as a fulcrum.
Years ago, we could develop vaccines to prevent diseases. Now we have to figure out ways to change behaviors to prevent diseases, which is much, much more difficult. And it takes the impact out of the hands of the scientists, so to speak. We cannot do this alone. This is not something that's going to be impacted in isolation in a clinic. It's not something that one organization can do. We're thrilled that Fit Kids just keeps growing and growing, where other partners in the community see their place in the coalition, see how they can have an impact on childhood obesity. Obviously, the Fit Kids Coalition has a primary focus of children, but the impact that we've seen is across the community, across all generations, because we're seeing organizations in the community really look at fitness and look at health and look at what's best for the community or best for our children. And we're seeing the city look at where can we build sidewalks, and granted money is tight, but where are there opportunities for funding? Where are there ways that we can improve the environment so that fitness becomes a way of life instead of a project? And that's truly the mindset of all of the partners of Fit Kids, is we want to make this a community. And when I say this, it's not just Lawton, it's Southwest Oklahoma, it's Comanche County. We want to make it a community where health is the easy choice, where you can find fresh fruits and vegetables, and where your kids can walk to school safely, where you have an opportunity on the weekends, instead of sitting at home inside your house, you have an opportunity to go out and be active and enjoy the wildlife refuge. Go out and take advantage of the bike trails and take advantage of the opportunities to be physically active. That was not the mindset a few years back. Now you're seeing more and more people really take a hold of that concept and see how all of these opportunities, it may be a business opportunity, but it's an opportunity to improve the health of our communities as well. There's a screen of some sort in front of them at all times, which reduces the opportunities for physical activity. And so that simple comment from the Surgeon General, I think, probably shook me to my core on a personal level. Professionally, childhood obesity is on the forefront of our minds because we have to figure out a way to address it. It's right there beside tobacco. So when you start thinking about things that impact the health of the citizens of Oklahoma, we know it's tobacco and we know it's obesity. You start talking about rights when you get into tobacco, and really when you get into obesity. You think about New York and banning the large drinks. People immediately get a little bit sensitive because they think that you're going to become the food police or the tobacco police, when in reality it's not about policing individual rights. It's about building a community, building an environment, again, where health is an option, where it's the easy option, where we don't have to worry about whether we go to a park if our kids are going to be exposed to tobacco smoke, where our kids go to schools where we don't have to worry about them drinking sugary milk or eating lunch from a vending machine, which is Cheetos and a Mountain Dew. So it's really looking at those and bringing all the partners together to talk about what their part is. What can they do in their environment? What's within their control, whether it's their church, whether it's their family, whether it's their business. What can they do to have an impact on the health of their employees, the health of their family, the health of the community? Because if we can all start changing our mindset, our children aren't going to have that destination of having a lesser life expectancy than our parents. And so when I think of childhood obesity, I think we don't have the right not to do something. As adults, it's our responsibility to improve the community so that our kids have a healthier life. So within the health department, we've started looking at, through every service that we offer, we started looking at BMIs. If someone has a high BMI, and this is for adults and children, we have registered dietitians on staff where we can refer them to those registered dietitians, and they can start working with them on plans and options that they can possibly reduce their BMI. We're doing things with school systems like the CATCH program, which is a program for after school where they promote physical activity and healthier snack options. They teach kids about nutrition and they get them active instead of putting them in a chair and saying, okay, now do your homework. It's a way to promote that activity in an after-school setting. So we ingrain obesity awareness, childhood obesity prevention throughout every service that we offer in the health department. And then, of course, the biggest impact, honestly, that we can have is just simply by being out in the community, partnering with the Fit Kids Coalition, partnering with those other agencies, talking about the best practices. We recently went through a community health assessment where we gathered all partners in the community were invited to participate. We went through assessments to say what's impacting Comanche County specifically. We know the statistics. We know that Oklahoma ranks 43rd in the nation in overall health. We know that that's not good at all, but it's gone up. We've improved. But we know that Comanche County specific ranks 52nd in the state. So Oklahoma ranks 43rd out of 50. Comanche County ranks 52nd out of 77 counties. So we're not looking too good when it comes to health stats. Those are health stats that every state and every county, so they're comparable across the country. What we wanted to know is specifically in Comanche County, what do people think are the health issues? What are our barriers? What are our resources? Where are our assets? And what are our challenges? And so we did a lot of different focus groups, a lot of different meetings, and gathered that information. And we put together a community health improvement plan where the community, Comanche County residents, Comanche County leaders said, okay, here are our top 5 priority areas. It's access to health care, it's violence, tobacco prevention, obesity, and sexual health. So those are the 5 things that the county has said we have to do something about. Obviously, obesity, we have a tobacco prevention grant. We have an obesity, or it's not called an obesity, it's a fitness and nutrition grant. So we're not trying to duplicate efforts at all. We're trying to figure out where our resources are in the community, develop work groups around those resources, develop strategies around those resources, and what our role is, I see as far as public health, is being the one to facilitate that process, to bring all those partners together, to go through the assessment process, to develop that community health improvement plan, and then now we need to feed in best practices. So while it may feel good that we go out and have a health fair every week to just educate people that, your kids need to eat healthy, we need to consider what are the evidence-based processes. What can we do that we know is going to have an impact? We know if you drive down 82nd Street, we know that people use sidewalks. If they have access to sidewalks, they're going to use them. We know that people will go out to the wildlife refuge if they realize where it is and what it's about. Once they get a taste of it, they go out there. So how can we promote the refuge but also respect the intent and the integrity of what their mission and vision is? So we don't necessarily want to leave a big footprint on the refuge. So therefore the partners came together and now there's a shoulder built so people can access the refuge as a family, riding their bikes or walking. So our role as the public health agency is to really work with all community partners, make sure that every community partner understands what their role is in preventing this issue and promoting a healthier community, and then also provide them with those evidence-based practices. And then also we need to help them look for funding. So we'll certainly write grants and help look for funding opportunities to fund those evidence-based practices so that we can have a bigger impact in the community. We can talk about the statistics and we can say that we're 50 or 43rd in the country and we're 52nd in our state in health rankings, but I don't think you can't put a number or a value to what Fit Kids offers this community. Fit Kids has really in the last few years transformed in my mind, transformed the way people see their community. Whereas previously we would talk about health and many people, unless you were a health entity or a health agency, would think, well, I don't have a place there, that I don't do health, the hospital is the person responsible for health, or the health department, or it's the school's responsibility to deal with my children whenever they're in a school setting. I think I've not seen it in any other community across the state that a community come together around an issue and really work together to come up with solutions. We may go down a road and realize that solution is not going to be as impactful as we want, and this community will really come together. Key leaders, we have Cameron, you have the school systems, you have the hospital, wildlife refuge, the YMCA. I could name over and over and on all the partners that have said, what's our role and here's what we can do, here's how we can contribute. So this community has a great resource in the partners, and so while the statistics look bad and you can't ignore them, we can't say, oh, well, that's not reflective of us, because it is reflective of us. The value of Fit Kids, of coming together and coming up with these solutions, these strategies to improve health in this county, is invaluable. So you're starting to see a change and a shift in the value of fitness, the value of health. We have a farmer's market finally. We have trails in our system. We have adventure bike lanes. So there's all kinds of resources that have been developed just in the last few years. And maybe if they haven't been developed, they've been brought to the forefront, or people even know that they're out there. So Fit Kids has done a tremendous amount of work and is a tremendous benefit into improving the health of this county, which obviously as a public health agency is our overall goal. We want healthy residents, we want a healthy community.